Hello, and welcome to another episode of the Med Madness podcast. Today we are diving into a fascinating and rare endocrine disorder known as aromatase deficiency. This condition can have significant implications on both prenatal development and adolescent health. Aromatase deficiency prevents the conversion of androgens to estrogens, leading to various clinical manifestations, particularly in female patients. In this episode, we will discuss the pathophysiology, clinical presentation, and management of aromatase deficiency. Let's get started. Next, let's discuss the pathophysiology. Aromatase is an enzyme responsible for the conversion of androgens to estrogens. In aromatase deficiency, this conversion is impaired, leading to an accumulation of androgens and a deficiency of estrogens. This condition first becomes evident in utero. Normally, the placenta converts fetal androgens to estrogens. However, in the absence of functional aromatase, androgens accumulate, leading to masculinization of the external genitalia in female fetuses. Despite this, the internal genitalia remain typically female. Next, let's discuss the clinical presentation. At birth, female infants with aromatase deficiency present with ambiguous genitalia due to the high levels of gestational androgens. They have normal internal genitalia, but the external genitalia are virilized, which can lead to clitoromegaly and other signs of masculinization. As these children grow, they may experience delayed puberty, osteoporosis, and other signs of estrogen deficiency, such as lack of breast development. Additionally, the elevated levels of androgens and gonadotropins can result in polycystic ovaries. One notable feature of this condition is that the mother of the affected fetus may also experience virilization during pregnancy. As the placenta is unable to convert androgens to estrogens, this maternal virilization typically resolves after delivery. Next, let's consider a case of a newborn girl named Sarah who was born with normal internal genitalia but ambiguous external genitalia. Her mother noticed significant changes during her pregnancy, such as increased body hair and a deeper voice, which resolved post-delivery. Sarah was later diagnosed with aromatase deficiency after a series of blood tests revealed undetectable estrogen levels and elevated androgens. During her adolescence, she exhibited delayed puberty and osteoporosis, and she lacked breast development. Her condition was managed with estrogen replacement therapy to promote secondary sexual characteristics and bone health. To conclude, aromatase deficiency is a rare but impactful condition that requires early diagnosis and management to address the various clinical challenges it presents. Understanding the pathophysiology and clinical manifestations can aid in timely intervention and improve patient outcomes. Thank you for joining us in today's episode of Med Madness. Don't forget to engage with the pre- and post-podcast quizzes and Anki flashcards to reinforce your learning. Stay tuned for our next episode, and as always, happy studying.